Well, a warm welcome to today's talk, Thursday the 7th of July. Now, I've had a lot of requests to do an update on monkeypox, so we want to do that today. It looks basically like we can say now that monkeypox is a new sexually transmitted disease. The question is it going to become endemic? And it's quite poignant for me, really, because I can remember the early days of HIV in the early 80s, having looked after one of the first HIV patients in the country when we called it HTLV positive way back in the early 80s. More on that in a minute. Now, just before we do that, I've been inundated with questions on the comments about the excess deaths that we've been looking at. We had firm data from that in the UK, and we had fairly strong anecdotal data and insurance company data to some extent from the United States. Everyone is asking, or a lot of people are asking, do we know how many of these excess deaths are vaccinated and unvaccinated? Or have had one dose of vaccine, 2 doses of vaccine, no doses of vaccine? The answer is we don't know. We do not have that data. It is not provided by the Office for National Statistics, so we don't know. Like me, you might think that is a bit of an omission on the part of the Office for National Statistics. We'll hope we get more data shortly. Anyway, let's get on to monkeypox. Let's have a look at the data first of all. So we do see quite a sharp increase in the cases globally. Maybe a little bit of levelling off, but there again, we know that these cases are massively underreported. So we do see this increase. Now, country-wise, this is what we've got. Now, again, of course, this depends very much on the amount of testing that's done in the country. We believe there's not a lot of testing being done in the United States. So the actual situation in the States is a bit hard to tell. But let's look at what we do know, fairly firm data. So United Kingdom, again, we're under testing, so this is a minimum. And Germany leading the way, unfortunately. Then we come down. Next up, we've got United States, France, Portugal, Canada, Netherlands, Italy, Belgium, Ireland and Australia. So they're the cumulative number of confirmed cases in those countries. Now let's get straight on and look at some detail on this now. And we're getting quite a bit of this. This is the first reference source here, Monkeypox Outbreak Epidemiological Overview, 5th of July 2022 from the UK government. Now, these are official government statistics. I know a lot of you question that, but a lot of the departments that produce these statistics are very good. So I think we can take these statistics as the best we've got. I think they're pretty good, but as the best we've got. Now, WHO is reconsidering calling a public health emergency. Of course, some of you might have deja vu there from 2020 and the SARS coronavirus 2 pandemic, where it took them ages to call a public health emergency, and it took them even longer to declare a pandemic, even though we've been calling them to do so on this channel for months before they actually did so. At the UK at the moment, monkeypox is what you call level 2. Transmission within a defined subpopulation with a high number of close contacts. So let's hope we don't go to level 3 and 4. That's where we are at the moment. So as we know, zoonotic infection from animals. It's a monkeypox virus, endemic in West and Central Africa, particularly Nigeria and Congo particularly. Now, the cases that we have in the West, all over the world, the outbreak, is mutations of the Nigerian strain, the West African strain. Now, this is fortunate because this one is serious, but less serious than this one. This one's got a much higher case fatality rate, many more deaths from this one. So we're fortunate in a sense that we've got the less pathogenic of the two, but that's not to minimise the situation. Now, the UK, between 2018 and 2021, there were 7 cases. 7. These were all epidemiologically linked to imported cases. So this was the original, what you might call the wild type virus before it mutated, coming into the country, travellers, sexual contacts, importing it into the country. So 4 were imported, 2 were household transmissions of imported cases. 1 was a healthcare worker who was looking after the patients. No documented community transmission until the 6th of May 2022. So that's when this current outbreak started. So you see, it's pretty recent. Quite high numbers for it being so recent. Now, outbreak mainly, so far, 96%, we believe at least, 96% have been in homosexual and bisexual men. And this comes from, quite a bit of this comes from this technical briefing. It's all there. Do peruse it for yourself. You can download the full document. All really quite comprehensible from the UK government source. And of course, everything we're saying about monkeypox from the UK applies everywhere. It's the same. It seems to be the same mutated virus which is causing problems around the world, as we've noted. So these people are without history of travel to endemic countries. In other words, this is caused by community spread. This is local spread that we're seeing. Cases got history of sexually transmitted. So of the people that have cases, 54% of them have history of a sexually transmitted disease in the last year. So these are people, mostly male homosexual activity, at risk of sexually transmitted disease, and 54% of them have had a sexually transmitted disease in the past, indicating that people who are taking part in this high-risk behaviour are the ones that are being infected. And quite a lot have had 10 or more sexual partners in the last 3 months. 31.8%. So 31.8% of the people that have this infection had 10 or more sexual partners in the last 3 months. Some might think that moderation is called for. So these are people with very high levels of homosexual sexual activity. Monkeypox is being transmitted in interconnected sexual networks that sustain sexually transmitted infection transmission. Direct quote from the, I think that one's a direct quote from the government technical briefing, or it might be from, oh no, that's the vaccination one. So I'm looking at these 3 government briefings for this information. And we'll have European information as well. Now, UK up to the 4th of July 2022, 1,351 laboratory confirmed cases. So these are actually confirmed by viral studies identifying the presence of the virus. There's more cases than that are just clinical, and of course there's many more cases than that haven't been detected, have not been picked up. So this is spreading round. And that's work done by the Rare and Imported Pathogens Laboratory. So these people are specialists in this. They're good at this. Scotland, 40 cases, 11 in Northern Ireland, 15 in Wales, 1,285 in England. Most of those, 77% in London. This is partly a founder effect, because we believe that the people that originally brought it, we believe from Nigeria, we believe they went to London. And also London, I suppose quite a few municipal centres are really, but London is there's a lot of gay male homosexual communities in London, and outlets for that sort of behaviour. 6 confirmed cases in women. Now, the cases in women, we don't know. We're simply not told if these are sexually transmitted. So are these people that live in the same household as people that are infected? Or are they sexual partners? We simply don't know that yet. But we do know that 6 women only have been confirmed infection. So the vast majority of this is in male homosexual communities. Monkeypox outbreak vaccination strategy. So that's this one. This describes the vaccination strategy that can be implemented. Now, the vaccine involved is called smallpox modified vaccine, Ankara Bavarian Nordic. So you can probably work out that this is not a monkeypox vaccine, it is a smallpox vaccine. There is no vaccine approved for monkeypox, but because of the similarities between that wretched disease, smallpox, that killed so many hundreds of millions of people throughout human history, and monkeypox, there's a crossover, there's cross immunity. Now, it's believed by most authorities in this field that vaccinating before exposure will have some degree of protection. We don't know what the efficacy level is, but some degree of protection against infection and or severe disease. Now, at the moment, people that are exposed are being vaccinated after exposure because they're going to produce quite a good antibody response within about 10 to 14 days after vaccination. Whether that works or not, we don't know. We simply don't know. We don't have data on it. It makes sense that it should do. That's why it's being done. But we don't actually have firm data on that. So it's being used for pre and post exposure. Now, this vaccine committee, they're wondering who to vaccinate at the moment. So they're using markers of high-risk behaviour similar to those to decide eligibility for HIV pre-exposure prophylaxis. Now, this HIV pre-exposure prophylaxis it's actually one of the treatments that can be used for treating HIV. And people that are engaged in high-risk activity can take one of these pills every day, and that'll reduce their chances of contracting HIV by about 99%. We know that these are effective. Some people might question the legitimacy of spending NHS funding to facilitate this sort of behaviour, but that is what we're doing now. It is currently available free on the health service, only on prescription. These criteria would include a recent history of multiple sexual partners, participating in, I'm sorry, this is rather delicate material, participating in group sex, attending sex on premises venues, basically mass orgy situations, or proxy markers such as a recent bacterial sexually transmitted disease such as gonorrhea would be the most common. Now let's look now at what the Europeans are saying about this. They do have a little bit. They have a little bit to add from this report here. Joint European CDC WHO Regional Office for Europe Monkeypox Surveillance Bulletin as of the 7th of July. So always good to be as up to date as possible. Just part of the concern here. I've got a couple of concerns here really. One is that even though this isn't massive numbers, I'm really concerned that children are more susceptible from household spread. Children can get quite sick with monkeypox. That's one thing. We don't want pregnant women catching this infection as well, because that could have adverse effect on the child developing inside the mother. So that is another concern. And we don't see it so much now, but I've certainly worked with a lot of people who had severe smallpox scarring from smallpox. Hundreds of millions of people have died of smallpox. And any virus which is similar to smallpox is a bit of a concern. Now, it is not smallpox. I'm not saying that. But this is kind of why I'm uncomfortable. Child transmission, fetal damage, potential fetal implications, miscarriage, and mutation to be more transmissible, because we don't want any poxy type viruses at all, really, monkeypox or certainly not smallpox. Smallpox still exists in laboratories, but thankfully we haven't had an outbreak for some time. Although be rest assured that it's in America. We've got supplies. We know for a fact we've got supplies of smallpox imported down in the UK, and I think we can rest assured that the Russians and the Chinese have got adequate supplies as well. The reason it's being kept, of course, is for the possibility of biological warfare. So it's all really quite nasty stuff. Anyway, European CDC, WHO Europe office, 5,000 microphones casting a shadow. 5,949 cases of monkeypox in 33 European countries reported in Europe. 99 cases where sequencing was available. So only 99 of these have been genetically sequenced, but it does tell us it's the Nigerian clade, the less severe West African clade, thankfully. But again, it does tell us that there's significant mutations. The existence of these mutations, by the way, has not yet been explained. Why the virus would mutate so quickly, because remember, this is a DNA virus. It's a deoxyribonucleic acid virus. It's not an RNA virus. It's not a ribonucleic acid virus like SARS coronavirus 2, for example, or influenza, which mutate quickly. The DNA viruses aren't supposed to mutate quickly, and yet this one has. So confirmed to, as we say, confirmed to be West African clade, fortunately. Implications for HIV positive men. Now, 40% of people who were diagnosed with monkeypox in Europe were also HIV positive. Now, HIV, of course, is immunosuppressive, and we don't have data on this in Europe if people with HIV are getting more severe monkeypox, but in Africa we know it is the case. But there again, many people with HIV in Africa, tragically, aren't as well managed on antiretroviral therapy as most people are who have HIV in the UK. So most people, and Europe, and indeed most of the states. So antiretroviral therapy, very efficient at keeping HIV under control, less well controlled sometimes in Africa. Monkeypox patients doing worse with HIV in Africa, but we don't know about the UK. I suspect it may not be a big factor if the HIV is well controlled, but we simply don't know, so ignore that bit. We should only say what we actually know. 99% of those with known sexual orientation stated they were men who have sex with men or bisexual. So European cases, 99% amongst the male homosexual community. Then just a quick data burst from the European CDC, WHO before we finish. Symptoms, reported case presented with a rash, 96.1% of cases presented with a rash. So the vast majority presenting with a rash. Nearly 70% had systemic features affecting the whole body: fever, fatigue, muscle pain, vomiting, diarrhea, chills, sore throat or headache. So virtually all, 96.1 with a rash, 69% also with systemic features. Hospitalised in Europe, just under 10% were hospitalised. Intensive care, virtually none, thankfully. No deaths, thankfully. 15 cases amongst health workers in Europe. So 15 health workers have picked it up. Now, the Ethiopian former politician and academic, Dr. Tedros, who's also head of the World Health Organization, I continued to be concerned by the scale and spread of the virus. Okay, nothing to disagree with there. Testing remains a challenge, and it's highly probable that there are a significant number of cases not being picked up. Again, nothing to argue with there. So we agree with the WHO as far as it goes in that situation. So there we go. That's a bit of an update. Where we're heading, we don't know. The fact that there is community spread in quite a few countries probably means it's being spreading for some time. So we would expect it to carry on spreading for some time, especially that we're now in the middle of summer and we have various gay pride demonstrations which apparently have associated intimate behaviour going on alongside them. It's really it really is time to start taking monkeypox more seriously in these communities, very much more seriously. We don't want another endemic sexually transmitted disease. So that's all we know about it at the moment. There are previous videos where I do sort of a bit more detail on the technical aspects of it, but that's the epidemiology at the moment. So thank you very much for watching.